Thanks, Marianne, for the invitation to join you today and to discuss the issue of why I think scale matters when we're controlling or planning to control NTDs now and into the future. And I'm distinguishing here between a changing climate and climate change. We could argue, there is no argument really, that climate change is occurring and will occur many decades into the future. But what about contemporary thoughts? We're living, I think we can term this as a changing climate. We see it every day. We see reports of extreme weather events. We understand now more as a population, as a global population, that climate change is affecting populations now, but will continue to do so, even with massive interventions. It's inevitable that things will change. One of the big questions is how things will change, and climate change is just that. It's a change, and it could go both ways depending on the context. And I'm going to explain to you a little bit some of my research that I've done collaboratively over the years to try and think about what happens at the local level, but also regional level, and how we can try and address those two things simultaneously, because there are some conflicts. Now, scale. What does it mean when we're talking about trying to consider interventions and prevention and control? Well, scale happens at every point in a society. It doesn't matter whether you're a stakeholder, a policymaker, a researcher, a citizen. You live at a particular place, and that place is a very local area, but you live within a community that is larger. You live within a region, and it could be an administrative, a political region. You could be bounded by natural or purely human administrative boundaries. You live within a country that is governed by a government. You live within a continent that has natural and man-made features. But going further down than that, even within communities, within villages, within households, within people, there are cells and molecules. There are parasites that have parasites that have parasites. The scale is very different. It works at every level. And we have to think really carefully about what scale is appropriate for control of NTDs in a changing climate and with the prospect of climate change. Now, my work has often focused on what I would call small area variations, and I'm going to give you a couple of examples of that, and then I'm going to finish with a contrast to that, which is working at a more regional level, and then think about some of the issues and how we can address those. Now, this is a collaborative study that took place some years ago in Kenya, and it took place in a couple of villages. Now, these villages are susceptible to exposure in terms of schistosomiasis mansoni, which is a parasitic fluke that infects hundreds of millions of people across the tropics and the subtropics. And the point of this particular research project was to test a combination of mollusciciding and chemotherapy to reduce transmission in these two areas. And the two villages were given different treatments. So one village was given a molluscicide over 4 years. This was administered into the local stream, the Thangi River. So there's two rivers here, the Thangi River and the Kambu River. And each of these villages was either given molluscicide or no molluscicide into the streams to kill off the snails to test whether that reduced transmission. So this is a local study. Now, during that particular research study, there was a freak storm, which was later attributed to an El Nino extreme weather event. And why this is becoming interesting in the context of climate change is it shows what can happen at a very local scale when there are extreme weather events. So what I'm showing here is a graph from the paper that was published in 2013. And on the x-axis, there are months. And this is in the early 90s. So we're going from January. Each of these letters corresponds to a different month. And the number of snails that were recovered in the village that received the intervention of mollusciciding. Now, what's important here is to notice that there is natural variation in the population of the snail over year because environmental conditions change throughout the year. There are periods of drought and there are periods of rainfall, and the snails respond because they have to respond to the differences in water availability, the temperature, and so forth. So it's a natural phenomenon to see variation. But what happened was that at one point there was a freak storm, this El Nino attributed event, that washed away all the snails. Effectively, there was rapid extreme flooding in this river and the snails disappeared. But what's important to note here is that they came back. And just before the mollusca siding started, there was actually a small resurgence. So there was a period of time when there were no snails, and then there was a period of time where there were some snails. And these snails are responsible for the transmission of schistosomiasis. They carry the parasite in them and release them into the water. So in the absence of snails, there's no transmission. But this extreme event did in fact clear out the snails for a while, but then they came back. And this tells us something about the adaptability of these organisms to extreme weather events. Although climate change is thought of and is due to anthropogenic influences in the large part, the climate has always changed, and these parasites and their vectors and their intermediate hosts have been through many eons and cycles of changing climate. And as long as the environment is still present, there are opportunities for those snails and other vectors to return, even if there has been a temporary effect by an extreme weather event. So that's one point I want to make. Now, over time, there was a success story in the sense that the combination of chemotherapy and mollusca siding was successful in the short term. But you can see here that this didn't last very long, because over years, if you look at 2002, 3, 4, and 5, after the end of the mollusca siding, after the El Nino event, the snails came back and transmission continued. And this is why it's important to keep going back to the same places sometimes and think about what might have happened in the short term, even after there has been an extreme event. You can't just rest there and say, well, they've gone, they're never going to come back. They may well do come back. They may well come back. And therefore, it's important to continue with surveillance in these areas that are susceptible. And surveillance is one of the key take-home points, I think, about trying to mitigate uncertainty. No one could have predicted the freak storm with any certainty, and nobody could have predicted with any certainty when the snails would come back and therefore represent a hazard to the people living there. So the conclusions from that study was that this El Nino attributed event in 1997 disrupted the snail populations for approximately 2 years, but there was a reduction in intensity of infection, and that was largely attributable to a combination of the extreme event, continued mollusca siding, and also chemotherapy. So in combination, they all did have an impact, but it was only felt in the short term. The second example I want to discuss this morning is now a research project I collaborated on in Uganda on the shores of Lake Albert. And I'm showing a map of an area where there is a village spread out along the coastline. And you will see that this map consists of a number of symbols. And there are triangles that are both open and have no color, and then there are black triangles. And they represent the households of people from different ethno-linguistic groups. And they occupy different parts of this village. You will also see, so the green is the land and the blue is the water of the lake. You will also see that there are squares and circles, and these squares and circles represent the two different intermediate hosts of schistosomiasis mansoni in this area, Bionfilaria sudanica and Bionfilaria stanleyi. And the size of the circles and the size of the squares indicate the relative abundance. So these data were collected through surveys, and the snails were counted in situ, so where they were. And you can see that the snail populations vary in terms of their abundance at different points along the graph, along the map, sorry. And you can see that one of the snails, Bionfilaria stanleyi, was found in a wider distribution than the other snail, Bionfilaria sudanica, which tended to be more inland in the marshy areas. Now, each of these, we know through other previous work, have a different sort of carrying capacity for the parasite. And what we found through this research study was that they were differentially affected by changes in the lake. So the lake was changing in terms of its environmental parameters. And I'm going to show you now some of the results of the research that looked at how the snails were affected by those environmental changes. So what happened during the period of between 2000 and 2002 was that the lake level increased significantly at the shoreline. So there was a lot more water going into Lake Albert, which would be a result of for example, extra water coming down the Nile, but could also be due to increased levels of rainfall, for example, and other factors that raise the level. So the important thing here is not how it occurred, but the fact that it did occur. There was a raise in the level of the lake and more water therefore present in the system. And that's seen very clearly on the graph on the left-hand side. Now, rainfall during this period of time went up and down, up and down, up and down. So the influx of water was not due to additional rainfall. In this particular case, it was due to probably more water coming down the Nile, which drains into Lake Albert. Now, what happened to the two snails was quite interesting to observe, because the lake level was increasing, but the Biomphalaria stangii that prefers deep water actually crashed during that period. Now, typically snail populations go up and down depending on local conditions and the temperature and other factors associated with the water at different times of the year, but there was a definite trend downwards, and by the end of 2002 the population had crashed. Biomphalaria sedanica, on the other hand, seemed to increase, going through greater amplitude of change over time, but also by November 2002 had crashed. So at the end of that period, the snails were very rare, they weren't really found. Now, what this suggests is that each of these snails have preferences for certain environmental conditions, but when those conditions become too extreme, in this case the lake level becomes too high, neither of them can survive very well. So this could be an example of where climate change affects the environment so much that the vectors, the intermediate hosts, cannot survive. And that means that if we move into more extreme climate scenarios, there may well be some areas that become less hazardous in terms of parasitic infections, because those areas can no longer be inhabited by the vectors, the mosquitoes, or in this case, the intermediate host snails, and that means they will be wiped out. Now, tie that into the previous research study that shows that even in extreme events, even if they temporarily wipe out a parasite or a vector or intermediate host population, may only be that situation may only exist for a short period of time, maybe a few years. So what we need to be careful of is assuming that when something happens to finish off a parasite in a particular area, that is the end of the story. We really do need to keep going back and re-establishing contact with those areas and ensuring that there is continuity in terms of surveillance. Now, the issue of scale matters because of two things. One, the future can be thought of in either days, weeks, months, or years. Now, typically, climate change projections have been made over decades, and this is a classic image that I've showed many times, and it's relevant in any discussion about climate change because it shows the uncertainty that we're dealing with at any scale beyond just the immediate day-to-day. So climate change projections typically are found in the literature to cover many decades, and those decades may be up to 2100. But as we move further into the future and think about, in this case, emission scenarios, so this is projected emission scenarios based on whether governments do or do not act to limit emissions. But what you can see is there's lots of lines, and these lines tend to go in one direction, they're going up or they're coming down. And there are these representative scenarios, the RCPs that were mentioned before in a previous talk, and they are just representative of all these different scenarios. But we really don't know what the future holds. It's impossible to predict with any confidence into the future. As you move closer to now, then of course the variation is less. So we can predict what might happen next week, next year, based on what we know about global cycles, but it's very hard to predict what might happen into the future. So when we're thinking about the scale of control, and we combine that with, say, the WHO roadmap on NTD control that goes to, say, 2030 or 2040, we have to be aware that even by 2030 or 2040, we're in the realms of the unknown. We really don't know what's going to happen by 2030 or 2040 in terms of the environmental parameters that shape the transmission potential and the natural history of these infections. We have to be aware of that whenever we're talking about discussing the end game for NTDs, and this is typically what the World Health Organization does. that the end game might be changed. It's not really fixed yet. We really don't know what's going to happen because of this issue of the time element, but also the spatial element, and also whether or not the parasites are able to adapt to those environmental changes. Now, I said that I've moved from looking at very local stuff to more regional stuff in terms of research interests. And this is a collaborative study that was funded by the EU a number of years ago. And I want to show it because it highlights the difference in the approach that is taken when doing comparing local surveillance and monitoring and measurement with climate change projections. There's a couple of things really to note here. One is that this is a fairly high resolution map of the potential changes in the habitat suitability for the snails that I mentioned before that transmit schistosomiasis mansoni. But it covers a wider area. We're not talking here about a village, we're talking about a region of several countries, including Rwanda, Burundi, Zambia, Kenya, Uganda, and Tanzania, all pointed out here on the map. There's another thing to bear in mind, and that is that it's necessary to look at these different scenarios of a low warming, moderate warming, or high warming. So each of those different scenarios, we've had to think about all of them simultaneously, and also think about scale in terms of whether it's near decades or far decades. So the example given here is 20 years or 50 years. And each of these maps is a little bit different. You can see the colors change, and that's indicative of the fact that over these time periods and under these different scenarios, the future will look different. And we have to be aware that it could be any of these. Now, that's very different to looking at a local scale. Yeah, this is a projection over decades. It's over a large region. And although this is quite a detailed map, it still doesn't tell us what's going to happen in one village in 10 years' time. It simply tells us that a region might be more susceptible to schistosoma transmission because the habitat becomes more or less suitable in a period of time. Now, this slide sort of summarizes some of the issues, I think, and I'll just walk you through it a little bit. Now, what we're facing is an increased global temperature. It's very clear that temperatures are going to rise. How much they will rise, of course, we don't know, but they're inevitably, I think, going to rise. And that's going to have a number of effects. In some areas, there's going to be decreased regional precipitation, including drought and more episodes of extreme droughts that last for longer. But in other areas, there's going to be increased precipitation. There will be floods and extreme events, one of which I've illustrated to you earlier. Now, those changes are going to then affect global systems and local systems simultaneously. And there's going to be a number of intermediaries on each plate, on each side of this. So an increased global temperature could actually improve the habitat suitability of areas that are currently too cold, for example, to support the parasites and their intermediate hosts and the vectors. And so that might increase transmission. On the other hand, increased global temperature might decrease the frequency of contact between humans, vectors, and zoonotic hosts because they have to they move away from that area, then forced to migrate because the environment is no longer suitable. So actually, the contact between people and the transmission organisms, the organisms that transmit the parasites to them, might actually decrease, and that would decrease transmission. Decreased precipitation might force regional level migration as well, and that might actually move people into more suitable habitats, or the habitats might decrease in size and therefore again have a deleterious impact on the ecosystem and the parasites and the vectors and intermediate hosts. And then floods, it's a similar issue, that there may well be pressures on the parasites and intermediate hosts that leads to adaptation. On the other hand, there may be asynchrony because in the short term, at least, the environment is not suitable because of extreme conditions. So I think what we're looking at here, and other presenters in this conference have alluded to this fact as well, that it is complicated. It is a complex system, and there is no one answer. There is no way in which one organization, one individual, however well-intentioned, one researcher, one stakeholder, one company, no one can do this on their own. It has to be a collective effort. Now, what are the ways in which we can think about being collective? I think there are a number of things we can do. We can develop better decision support tools. You may have heard of this thing called if this then that, and that is the bedrock of a lot of decision making where a certain situation arises and you do something about it based on that situation. Improved surveillance is part of that, and also capacity building, because we can't just assume, and there was the first presentation by Dr. Lendrum pointed this out, that the resources simply aren't there really to make massive gains in terms of enlightening people to the problem, but also putting in resources for successful interventions. But I think what we need to do in the future is be able to have a much better view of the global, regional and local distribution of these infections through surveillance at various locations. You can see I've just constructed this map here. You'll notice there are lots of little squares, and they are units that you can imagine exist. You can overlay this onto a map. It's a grid that you can overlay, and you conduct surveillance at each of these points in the grid. Now you then monitor what might be happening, and there are what we might call tipping points that happen at specific locations, and that might be that global warming leads to increased rainfall at a specific location. It may be a dam construction that leads to slow-moving water that supports the snails that transmit schistosomiasis mansoni, and so on. And land use change, livelihood changes, these may all have an impact, and this comes down to these. Sorry, this involves a decision support tool, because you can make a decision based on the observation. That can then lead to more intensive work around understanding how that change affects the hazard and the vulnerability of local populations, and then location-specific actions can be taken. Now, this is a framework, and of course, it's very easy in a way to put a framework. The problem is, how do we translate this framework into reality? Well, that involves bringing in more people. It involves increasing awareness. It involves championing. WHO, I think, has a unique role in this because of its ability to reach out, and through its roadmap, I think it should make a lot more effort to understand some of the challenges. At the moment, it only mentions climate change half a dozen times, and so it's really incumbent, I think, on WHO and OIE as well to ensure that their documents, their recommendations, their people have that link. It's not a case of being interested on, as Dr. Lendrum said, climate change or NTDs. There has to be an interest in these organizations that crosses over and has NTDs and climate change thought of simultaneously. Thank you.